Health officials in Norway are adjusting their COVID vaccination advice after the deaths of 13 elderly people, possibly from side effects, after being given a dose of the Pfizer vaccine. All those who died were care home residents aged over 80.
It seems that some of these patients get such severe side effects in the form of fever and malaise that it can make a very serious illness even more serious, which may lead to death.
Norway launched its COVID immunisation programme with the Pfizer vaccine in late December and on Friday rolled out the Moderna vaccine too. Nursing home residents are on the priority list. Since then, 29 have been reported to have suffered side effects after getting the Pfizer jab. But the National Medicines Regulator insists it's not alarmed by the numbers, adding the risks are low, except among the most frail of patients and people with underlying health issues.
If the authorities in Norway believe that there may be a problem, then it's right to be cautious. But vaccines should only ever really be given to people who are fit and well. In any case, if somebody is seriously unwell or frail, then really doctors need to think about giving them a vaccine. I think that the Pfizer vaccine is one of the, in terms of its effectiveness, initially at least, seems to be one of the best vaccines on the market. How long that lasts for remains to be seen.
We vaccinated, as you said, about 30,000 patients in Norway, and many of these patients are living in nursing homes, and many of them are very severe diseases and are very frail people. So we expected to have some deaths in close temporal connection with the vaccinations. So when we started looking at some of these adverse reactions, we saw that some of the most frail people, some of the oldest people, seem to have adverse reactions. The common adverse reaction for these vaccines: fever, nausea, diarrhea, etc. And since they are very sick, it may be affected their underlying severe disease, the course of their underlying severe disease.
So what are you saying now to people who are handing out the vaccines? What are they meant to do? How do they assess if somebody is too frail or too old or not well enough to take the vaccine? Is there any sort of standardized practice that you're telling these people?
No, it's very difficult to standardize this. This will be a decision made by the attending physician, the nurses, the relatives, and the patient itself. And what we say that if you have patients who are very frail, very sick, and have a short remaining lifespan, you should do some extra evaluation of the appropriateness of vaccinating these patients.